Superficially, we will find 4 muscles. So the most superficial one. So here we have also the fascia, the pectoral fascia, yes, which covers all of this. And under the pectoral fascia, we will find pectoralis major muscle.
Yes.
Pectoralis major muscle, it is in here, yeah. And it also consists of 3 parts: clavicular part, sternocostal part, and abdominal part. Clavicular part originates from the sternal end of the clavicle. Sternocostal part originates from the sternum, body of the sternum and costal cartilages. And the abdominal part originates from the anterior layer of the rectus sheath. And all this stuff, it also attaches to the humerus. Pectoralis major muscle also forms the anterior wall of the axillary cavity of the axilla, and it also helps with adduction of arm and its medial rotation. Adduction is closer to the midline. Abduction away from midline. Yes. I mesmerized it in very strange way because the difference is only in one letter, B or D, yes, but B is closer to the beginning in the alphabet, but it does action away. And opposite, adduction is further in the alphabet, but it moves
closer to the mega.
Yeah. So, not very logical. So, if we will remove pectoralis major muscle, we will find under it the pectoralis minor muscle.
Yeah.
Pectoralis minor muscle, it looks quite similar to some serratus muscles. It will originate from our ribs, from 3rd to 5th rib, yes, and it will insert into the coracoid process of scapula. And normally it will move our scapula anteriorly, yes, not posteriorly. Only how it will move it posteriorly? It will pull it posteriorly. Just think, simple muscles, they does only one main action, yes, in one direction, because totally all our movements, all our body state, body position, it depends on the difference between the muscle tone of antagonistic muscles. Yeah. So we have agonistic and antagonistic muscle. Agonistic muscle, they are doing the same stuff. Yeah. So we have, for example, different flexors. They both flex something. But antagonistic muscles, they does opposite actions. So, for example, flexors are antagonistic to extensors. Yeah. Adductors are antagonistic to abductors, and so on. And all our body, it usually, if we are totally relaxed, our body is in this balanced position between the tone of the extensors and flexors. And as soon as the tone of the one group of muscles will become stronger, yes, the action is formed. Yeah, for example, when I flex my forearm, it means that the tone of my flexors are more than muscle tone of my extensors, and the rotations. So you can't, for example, flex your forearm and extend it by one muscle. Yes, you have muscle for flexion and you have muscle for extension. Yeah? For example, your biceps flexing it, your triceps extending. And the same stuff with most of them. Yeah, there are some muscles which are not working by this rule because they are large and they have multiple fibers which are directed in different places, like trapezius muscle. shown, yeah, because it has one part which goes from up and the second one from another part, and they can work separately from each other. But usually one muscle makes action only in one direction.
Muscles are unidirectional. Muscles are unidirectional.
No. Most of them.
Most.
So this muscle, it will pull the scapula anteriorly, but if our shoulder girdle is stable, if it is fixed somewhere, yeah, it can elevate ribs to help with the inspiration. And you will see that a lot of muscle they can help with the inspiration if we will fix our shoulder girdle. Like next muscle, which is serratus anterior muscle. It also originates from the ribs and attaches to the scapula, and also usually it moves the scapula, but if we will fix our shoulder girdle, fix our scapula, it also can help with the inspiration. How does it work? There is a position in some patients when they sit and they put their arms into their seat, like into the bench, chair, bed where they sit on. And by this movement, yes, they sit and just stabilize their shoulder girdle. It helps to involve more muscles into breathing.
More muscles too? It helps to
Involve more muscles into the breathing process. Respiration. So, serratus anterior muscle, yeah, we can see it's serrates attaching to the ribs from the 1st to 9th, yes, and it will pass posteriorly to the angle of the scapula. So we can find it, for example, in this chart. Here we can find the origin, well, the attachment point of the serratus anterior muscle. It is mostly on our side, yes, and as I told you, it can move the lower angle of the scapula laterally, or help to breathe in by elevating the ribs. And the last superficial chest muscle is called subclavius muscle. Subclavius muscle. It originates from the first rib, from the superior surface of the first rib, and it attaches to the inferior surface of the clavicle, holding the clavicle and the sternoclavicular joint, and sometimes also elevating the first rib. If your clavicles are stable, again, yes, if they're they will slightly elevate to help with breathing.
While breathing in?
Yes, with inspiration. What else? The deep chest muscles, which you need to know, are intercostal muscles. Actually, there are 3 layers of intercostal muscles. There will be external, internal, and innermost intercostal muscles.
Yes.
On this chart, only external and internal are visible. So, if you will look closely, you will see that here we have between 2 ribs, one muscle and another muscle under it. They are passing in opposite directions.
Yes.
Yeah. So, external intercostal muscles, they are directed from the upper rib to the lower rib, and fibers are oriented a bit anteriorly, yes, and in the external intercostal muscle, it doesn't reach the sternum, yes, it terminates 1-2 centimeters laterally from the sternum. So here this muscle already terminates.
Okay.
That's why in this position we can find internal intercostal muscles. You can see that they have opposite direction. They originate from the lower rib to the upper rib. And this difference between the direction of these muscles is needed for their opposite actions. Because external intercostal muscles, they will elevate the ribs, and internal intercostals, they will oppositely depress the ribs. Yes, and here we can see that this space between from the sternum and to the beginning of the external intercostal muscles, here only this spot, internal intercostal muscles are visible. And the innermost intercostal muscles, they can be seen only from the internal surface of the thorax, along with the one more muscle. So you can open the pages where we can see internal surface of the thorax, like this. Yes. No, this one. May I take one here? Yeah. So here on these pages we can see first of all innermost intercostal muscles. Here they will be, and the transverse thoracic muscle. Transverse thoracic muscle, it originates from the internal surface of the sternum, its body and xiphoid process, and it will be attached to the ribs, to the internal surface of the ribs from second or third and to sixth.
Okay.
Yeah, and it will also help with breathing out, yeah, by depressing the ribs.
Okay.
Any questions about chest muscles?
The internal intercostal muscles will do that.
Innermost.
Innermost.
Innermost. Yes, and internal they are.
Transverse thoracic. So these are the same muscles.
No, these are. I told you these are different. These are external and these are internal.
Okay.
They will get
Yeah.
elevate.
They're like
They'll
decussated.
elevate the leverage, no? Right?
Yes.
क्या बोला?
इंस्पायरेशन एलिवेशन रिलैक्सेशन ऑफ
Any other questions about chest muscles?